Good morning, ladies and gentlemen. Welcome to another episode of Monitor Your Health, the program where we educate the public about contemporary medical conditions. My name remains Dr. Femi Ogunremi, and today we'll be talking about suicide. Suicide is a global issue. About 1.5% of death that we have globally as a result of suicide. With me on the program today, I have Dr. Wasiu Omokanye, a psychiatrist from the United Kingdom. Dr. Omokanye, you're welcome to the program.
Thank you very much, Dr. Femi Ogunremi. Before we go on the discussion, I would like to kind of commend you for your program. And I think the award that is being given as part of diaspora, professionals, especially Nigerians. And I think we are very, very proud of you. You're doing a nice job. And I think it's something you deserve. So I think maybe after the program, you can pick up your check as my own part of the contribution to this.
I will try to pick that up,
and thank you for inviting me for this an interesting topic. And I think it's something that we rarely talk about, especially in where we're coming from as developing countries. And this is one of the major issues why this remains a kind of a strange, topic to talk about this morning. So just like you said from the statistics you quote, suicide is a serious global public health issue. And I think it's one of the leading cause of death, ranging between 1 to 20, amongst the 1 to 20 major cause of death worldwide. And with 80% of this happening in lower and middle income countries. And I think Nigeria falls within this category. But we rarely talk about it. So, it is something of important public health issue. And I think, this program this morning is going to be able to answer most of the questions that some people might have.
Thank you so much for that, introductory comments. I think before we actually step in, I would like our audience to meet you. So let them know what you do and who you are. So
okay.
Yes.
Sorry, I forgot. My name is Dr. Omokanye. I'm a psychiatrist, and at the same time, I'm an epidemiologist as well. I'm interested in cause of the disease distribution, and control and prevention. So my area deals with much of children with mental health difficulties.
Right. Okay. Thank you so much. So suicide, I know you've talked about it a little bit. I want us to, what does it even mean when we talk about the word suicide? What does it mean?
Well, the definition simply is just an act of when an individual intentionally decides to end their own life. So that is just simply the definition. And I think they do this by various means, accessible to them at the time when the act is committed. We've seen people jumping from height, we've seen people using firearms, we've seen people taking poison, we've seen people, overdosing on medications, prescribed medication, non-prescribed medication. We've seen people, drinking alcohol up to the stupor and then, they're, ending their life. Simply, that's the definition of suicide. So it is intentionally done by an individual, and it cuts across, ages, culture, faith, religion, occupation. So it doesn't leave anyone out. So
right.
Yeah.
Thank you. That's kind of worrisome and kind of concerning when an individual takes their life. So what are the things that could be responsible for this? So because obviously you mentioned it during your initial commentary that we don't talk about it in this side of the world, and we just assume that it's not there. It's not. In fact, there have been a lot of attribute what people attribute it to. Like there's so many taboos around it. People don't even believe it's a medical condition. So, in the first place, is it a medical situation or something else? Because people believe it's a cause on individual for that to happen.
Well, from the area where we come from, well, Africa, we got this beliefs and stigma about mental health. Well, before I go into that, let me answer your question as to whether it's a medical condition. Yeah, definitely. Um, 90% of suicide is due to mental health difficulties, and I think the rest of the 10% is due to other reasons. So, and from your flyer, you did put in there that low mood and suicide, because depression, tend to be the major cause of suicide in mental health. So when you say, whether it's a medical condition, definitely is a medical condition because mental health is a medical condition. But at the same time, the remaining 10% is due to other things. Maybe they are not recorded. And in a country of low income, where there are 80% of the cases of the global, um, you know, death rate due to suicide is attributed to taboo or maybe a curse on an individual. Several times we've heard about people not, thinking that, well, maybe an individual did a kind of, um, you know, some rituals, and I think then it turns, over and turn to their head, and then it goes, wrongly, and then from there, leading to suicide. So there's a lot of taboo. There's a lot of stigma, even mental health itself, a lot of stigma associated with it in many of the low income countries. So now, going back to your question as to what causes suicide, there is no major cause of it. But the only thing we know is that there are many people, people are vulnerable, and there are many factors that make people to be vulnerable, especially people who later develop a kind of a major mental health illness. Some of which would be, to mention but a few, is the one I've mentioned previously, which is major depressive disorder, bipolar disorder, schizophrenia, which is a major mental health long-term illness. We've seen people, with drug addiction, people with alcohol addiction, and people with what we also, you know, refer to eating disorder like anorexia nervosa. So people in these categories, they do have more higher prevalence of suicide. But it's not all of them that actually end up committing suicide. There are no other risk or vulnerable factors that lead them to be suicidal.
Right. Thank you so much. So, yes, we understand the fact that there are associated factors or things that predispose people to this condition. Um, but you mentioned it's not all of them that would then go ahead to commit suicide. So what makes the difference between maybe somebody thinking about it and somebody actually doing it?
Absolutely. So that's a very, very, very good question. So somebody thinking about it and somebody actually going about, ending up doing it. There's a lot of a gap between the two in terms of, you know, um, what kind of support these individuals are getting. When people are not even recognize or seen to have had mental health difficulties in the first instance? How do you know that they need help? So in most, low income countries where there is, poor services, people don't even know that, they've got mental health problem. Even the family don't know that they've got mental health problem. And there are some telltale signs, that actually, make people to know that, look, this someone might need help. So in the first instance, they are not diagnosed. They don't even know that they've got mental health. So this kind of people, they become, isolated, and there's this what we call about instant negative thinking, negative thought in the head, which of course is associated with depression, because of the major losses, and because an individual who is struggling with mental health definitely will suffer major losses. I know that's when they become hopeless and helpless. So the only thing they see is that there is no light at the end of the way, at the end of the tunnel, and the only thing they see is just, the solution would be that, well, ending it. Okay. So that's one category. The other category of people is some people might still be getting the help they need. That, maybe in some developed countries, they're getting the help they need. Still have those factors that we mentioned about, you know, where their mental health become more complicated, start to use drugs, start to use alcohol. This kind of categories of people can be more prone to committing suicide rather than thinking about it. So that's just the difference between, low income and high income.
Okay, thank you. So, in your commentaries, you've talked a lot about low mood, depression, and it seems to be one thing that has been flagging up as you discuss this topic. So, what's the relationship between this low mood and depression?
All right. Okay. Low mood is a symptom of depression.
Sorry,
Someone might have
suicide.
a sorry.
Yeah, sorry.
So
Low
as in
mood,
relation to
suicide.
suicide. All right. Okay. So low mood. That someone can have low mood, and I think the relationship is really very very important. Someone can have low mood without necessarily being depressed. Okay. So having a depression, depressive disorder, as in when someone's got long-standing low mood, that is affecting their functioning. They're not able to sleep, having kind of negative thoughts in their head, believing that they are not good, that those negative, automatic, thinking in their head, and believing that they are not important, they are alone, people don't like them, people don't need them, it can get to a point where they start to think that, look, it's rather better to die, that even if they have the loved ones, they'll say, well, I think, it's rather than being a burden to them, it's better for them to just, end it. So that's the level of depression where a suicide can happen. But some people with low mood, either due to tragic events, you've seen people who maybe they lost a lot of money to lottery, or maybe break up in a relationship, very important relationship, and then, or people who's maybe lost, an important job, and at that particular point in time where they're supposed to get some help, maybe from the loved they are not getting it because of the other associated factor that we're going to mention about. At that instance, they may not see any other way out, and suicide will be the only option. So in that situation, you can see that they are not necessarily having depressive disorder, but they develop low mood due to tragic events. So that in itself, the relationship with suicide, they can compute suicide if they are not getting the help they need immediately.
Right. Thank you so much. So, our mood is really important, and I think primarily from all I've gathered in our conversation so far, yeah, there's need for us to actually protect our mood as an individual. And also, you've mentioned about some important or significant, events in people's life that one way or the other, maybe they've lost it, and then that hits on their mood. Then the mood plunges, and then that then leads to the thoughts of suicide. So, what do you want to advise people, or what are the things that we need to do to actually prevent this terrible occurrence, happening?
Yeah, you made a statement now, and I think which is very important, which is on an individual level, improving our mood, not necessarily being happy or staying on top of things. And I think there are various ways by which we can do that. Tragic events does happen, and I think what is important is always to always expect that when things like this happen, we're always in contact with people, and we try to open up as much as possible. Speak with people you trust. Talk freely. Okay. Although there are people with different personalities, some people it's very easy for them to talk. It's very easy to you can meet some people within a few seconds. They start talking about their whole life. But what some people it takes a lot to even get what's their name out of them. You can see this morning you asking me for my name, I couldn't even remember. So people are different. So try to identify your own, personality, okay, and that would help you to be able to seek when you need that help. Okay. So also it's always good to stay healthy, and I think people have talked about good exercise. Okay, it does improve mood. I think the same level that medications that doctors use to help people to improve their mood, we also have a natural endorphin in our system that exercise can help to boost. That in itself can help, even when tragic events happen. There's going to be a minimal, well, there's already a kind of a shock absorber that is going to help with that. And I think physical exercise also helps us to get relaxed and all that, and then move on with life. Also, healthy eating as well is very, very good, at making people to stay healthy and with good mood. Also, get involved in social activities, connect with people. You haven't seen friends for many months, try to want to connect back with them. Now, this is the period where people have to put ego aside, even if you don't want to directly reach out to them, you can ask a friend, have you heard from so person, for some time? And then you say, yeah, I haven't heard from him, or you can try to kind of seek to ask for that person just to be sure that that person is fine. And also you are even helping your own mental health as well by seeking to see them. So on subpopulation level, going above the individual is family level, which of course is one of which I've just mentioned. When you haven't seen someone for quite some time and it's very, very unusual that person, I think what helps people is to try to reach out and say, look, how are you? How are you doing? You don't have to ask a specific question. Just open question is enough for someone to start to talk. Also, on the population level, I think a lot of government have to do a lot, to be honest with you, to help citizens, especially those who are struggling, who haven't got close relationship, who can actually go to, although I know there are some, public non-governmental agencies and charity organizations that help people who are struggling with mental health, which people can, confidentially can discuss with and tell them the problem, not necessarily offering them solutions, but just advice and being able to listen, would help a long way. So these are the things, simple things that help people. And another funny thing, and I know if you heard about it, a few days ago, I was listening to one of the former senators on social media who was talking about government suing him for wanting to commit suicide. So I was wondering, how this kind of legislation still exists. I think Senator Dino Minai also, he said he's got a legal case with federal government suing him for wanting to. And these are the things that people, government should review that legislation if it still exists, and then rather than persecuting or prosecuting people who are struggling with mental health, I think the helpful thing is to do is to rather offer support.
Right.
Yeah,
Thank you so much for that explanation. When you were discussing now, you touched on an area which I would like us to explore a little bit. You talked about the social media. What's the yes, you've briefly just mentioned that, but social media is something that at this, I mean, this jet age now, a lot of people are glued to the phone, and then you're talking about a relationship, a kind of mingling and chatting, meeting your peers, friend, family, and things like that. That this helps our mental health. But these days, people are addicted to the phone. You see, especially the teenagers, they glue to their phone these days, and they learn all sort of things from it. What are the risk, or no? What can people do from this relationship that we now have with the social media? How can people tidy up their mental health to prevent unnecessary, bad mood and even suicide?
I think this is mixed, to be honest with you. Social media, if I touch on the teenagers, like you mentioned, or young ones, you could see that there are some merit and demerit. You know, um, when it comes to mental health, social media, and young ones, I think it's something that parents have to be really, really very, very careful about. Because we've seen cases where there are a lot of bullying online. Okay, and I think you've heard about the cases of um, where online media where children were being told how to commit suicide, how to self harm, and I think there's one case in England where the parents went to court and challenged the the platform. So it is very important because one of the factors that made children to wanting to self harm and commit suicide is bullying. Continuous bullying for quite a long time, which of course causes them trauma. So for children, I think the demerit surpasses the merit, because when you talk about merit, it's about when a child also becomes isolated, it's something you don't want to encourage. And I think these days they don't go out much because of the advent of social media. Um, Many of them do connect online, chatting. Some even do distant learning. This age of coronavirus, they didn't have other options than to learn online. And many times you can see them switching from social to educational media. So it's very, very difficult to control, but I think parents have got responsibility to many times try to listen to their children when they are talking, and I think that's what's most important. You try to detect certain changes in them. Maybe the way they communicate is becoming really different, and I think what helps is maybe from time to time ask them if they've got anything to tell you, or if there are. In fact, sometimes you can even use it as a kind of a direct question and say, "Look, are you being bullied?" Or you ask them, "You don't look right. You look sad." All these kind of things are very ways of opening up discussion with children, because many children find it really difficult to open up discussion unless parents ask them. Um, and when that medium is established, it's very easy for children to start to talk about what's happening online. So if you feel that it's becoming dangerous for them, then certain things have to be done. You can even report to the law enforcement agents who will do something about it. So we've seen many cases of children copying self-harm, copying suicide from the effect of bullying online, social grooming. So for adults, I think, this affects almost everyone. And I want to say myself inclusive. Sometimes I find it really difficult to put down my phone. And so in terms of social connection, I think is an advantage. And also, we do have some kind of negative feedback from online as well, apart from trying to improve our, social connection at the same time. We're getting some kind of wrong perception from people. And I think adults also bully themselves as well. You can see some different messaging, people are trying to kind of, online is a very good medium for them to get at one another as well. So as they have some advantage, they have disadvantage. And I think it's left for an individual to make a choice and also control the use of
All right. Thank you so much. So there is a question from the public here. Mental health needs. Oh, okay. Let me just go straight to the question. What do you think can be done to stigmatization attached to mental health?
it. Yeah. Well, the thing is, there is a lot to be learned, to be honest with you. Number one, we've got, and I think stigmatization is not just limited to developing countries or Africa or Nigeria. I think it's all over. Even in England, not until recently when public figures have started coming out and start talking about their own experience. We've seen cases where the Duke of Edinburgh come out and said that I had depression. The princes, came out, all talking about their experiences and everything. That people start to come out and say, look, I had depression, I had bipolar, I had this and all that. So people no longer afraid of coming out to talk. But what I've known with us in Africa is mental health many times is seen as a sign of weakness. And also, it is not easily recognized as a serious illness. And also, because of the strong faith, many people don't even believe they can have mental health. So, so in terms of stigmatization, I think the responsibility lies with everybody, families, individuals, um, and also people who have had this experience to always come out and let other people know about their experience, even if at all they are having anything similar in terms of symptoms or they just had an event that is, traumatic, tragic, uh, before it gets to the point where, you get to point of no return where they start having major mental health difficulties, especially those who are really prone to developing it, to seek for help. There's always help there. So dealing with stigma is about coming out and letting people know about your experience. And also government also. I did mention about the legislation where government is, prosecuting a senator for expressing suicidal ideation. So all these are the things that will help, with stigmatization.
Right. Thank you so much. So now I know we've talked about all this, and then we've talked about the stigmatization, and we've talked about things. As we're rounding up, there's one thing I want us to, or a couple of things I want us to also explore. So for individual who might not even know what it means to commit suicide, but they have something they can't explain. How would they know that this thing they can't explain is actually they are actually symptoms that can lead them into the path of going down the route of thinking about suicide or even actually committing suicide? What are the things that people need to watch out for?
Okay. So at the individual level, this is the person who is suffering, you know. And I think what leads people to pursuing suicide as the only option is when they've lost hope, okay, and when they feel helpless. So number one thing is, well, which is quite common, is when a tragic event happens. Okay. An individual may become withdrawn, okay, become socially isolated, not wanting to see people, start to think that they are bad, they are worthless, they are useless. Um, so this is the way they perceive themselves. And and from time to time, the thought creeps into the head like, look, I don't think I'm having any other option. I think I would rather it would rather be dead. I would rather feel better to be dead than being alive. So once this thing is starting to creep into someone's head, should know that this is the time to seek for help. And seeking for help is a kind of seeking for an emergency intervention. And the emergency intervention is just being able to speak with someone who is ready to listen. Okay. And that saves life. It's not about going to the hospital or they're going to be tied down in the hospital or somebody's going to restrict them or lock them up in a room and say, we don't want you to commit suicide. No, just speak with someone and let someone know exactly how you feel. Um, Something happened negative, maybe major loss. Okay, let me give you one example. A very good friend of mine, we just, then out of school. And I think if he's listening to this program, he remember. He that was then in Abuja, he was a young contractor. I think he got his first contract at that time. He was given about 2 million naira and said, this is your I don't know what they call this money they give you before you want to execute this contract. So he put it in the boot of his car, and then on his way to where he was going to kind of buy those things that he was asked to supply, armed robber followed him. And when he got there, the money disappeared. Do you understand what I mean? So they took the money away. So what these guys do, that was in the evening. We were in the club. We were at the club having a nice time. What he did was to pick up his phone and rang me and said, look, where are you? So I told him we're at the club. So he joined us immediately. So we were about five of us sitting down, having nice time. And then he said, you know what, Waspa? I just lost 2 million naira. You can imagine that time, 2 million naira, what it is. And then everybody had this, everybody was shocked. 2 million naira, And I think this is a guy who's got a very strong faith, right? But he didn't limit himself to that strong faith. And look, maybe something because of this tragic thing that happened, maybe I might be able to manage it. What he did was himself, he volunteered and said, look, Waspa, I don't think it's advisable for me to go home today because he lives alone, he wasn't married then. I think I should go with you to your own and stay with you for tonight. You can see things like that. Those are the simple ways where people can actually prevent, suicide, especially following tragic events. So, with people who are already diagnosed of having mental health difficulties, what they should look for is when they are becoming more depressed, their depression is becoming more severe to the point that they start having kind of irrational thought in their head, having unnecessary guilt feelings, um, thinking that maybe seeing the world in a negative way, seeing themselves as negative way, start to drink more, abusing drugs. This is the time that these people should seek help because that is the point where they can get to the point of no return.
Thank you. Thank you so much. So, people at home, I hope we're hearing this. So there are times that things do happen. I mean, events happen in life. We can't help it. Just like, you know, Dr. Omokanye has just said, there are situations that lead us to, uh, places where our mood just plunges, but just like particular example that you have mentioned, we need to know a way to protect our own mind, to protect our own moods. And don't forget that your relationship, your friends, your close allies, people that are close to you, they're there. But one thing I want to step on, and which also linked to what somebody has mentioned in the comments below, is, sometimes when we get to this stage, a lot of us go to, to our religious leaders, or we go to people that we see that, as maybe prominent in the society. They might not be skilled enough to actually support us. And that will lead to that question, that what would be the advice, to people like this in situations? Like, I mean, I know we have therapists, we have, people that people can actually explore to discuss this with. But when we go to religious leads, some of them might not even be skilled in this. And I know that we are very religious, especially in our side of the world.
Yeah, absolutely. I think this is a very, very important point that's brought up because, we are highly religious. I think most of us in Nigeria, when things happen to us, the first point of call is either to the pastor or to the imam. Don't get me wrong, this is one of the protective factors, faith, but also there could be some kind of confounding factor in this. What I mean by confounding factor is there are factors around this that may be the one that is actually protecting people, but not because of their strong faith. Because we've seen pastors, we've seen imams committing suicide following tragic events, and the question would be, why did they do it? And I think the thing is, for someone who is a church goer, in a way, had a chance of social interaction. It's very easy for them to see someone who's got that innate skill or innate gift, not that they had any, training or qualification to be able to counsel people. It's just by talking and by listening. Some people have got that ability to listen to people without being judgmental, without offering solutions. It's just listening and then let them talk, and then they be of help. So the thing is, the individual that is suffering knows people well. In a way, when they are talking to individual, they know those who are helpful. They also know those who are not helpful. And I think you're right. I say some pastors only have those skills of being able to read from the scripture and then being able to give people messages, but don't really have that counseling ability and not being judgmental. Some can even be offering solutions that are not helpful. So when people are in this category, one thing they should know is that it's not about evil, it's not about devil, it's not about demons. And I think within the church in itself, there are people apart from the pastor or even in the mosque, apart from the imam, who can be the people who's got that gift of being able to counsel someone without being judgmental. So individual can just look around and see someone and then talk to them. So it's good to talk to some imam, it's good to talk to some pastors, but when it is not helping you, you should know that that is the time to stop talking to them about.
Thank you so much. So I think the key point there is there's a thin line between all these things. And I think what I love that is being mentioned here now is that it is very important for us to know that line when we're crossing over. We're very spiritual. We should be, because it's a key factor in our society. And but it'd be good for us to balance things out as we're speaking
Absolutely.
to from the spiritual aspects. Don't forget that the physical aspect also needs to be managed, and that's where that's where we're coming from. We're not discouraging people from going to the pastors or the imam, but we're saying that at times the skill to actually balance things out, to prevent somebody going from that to cross that line, which is very, very thin. It's important for us to identify that as a red flag. Thank you so much, Dr. Omokanye, for this morning. As we just use the next 1 minute to talk about, the possible, treatment. So, that is, that one can can get, or how we can manage this. Just 1 minute.
Yeah, the treatment, and I think is just like I said, people with major mental health disorder, 90% of suicide cases are due to this. And I think the treatment would be that to prevent suicide by adequately treating these mental health difficulties. We talked about those other 10% that are due to other things, either maybe due to tragic events or things that we don't know. So for the other 90%, people with depression, there are combinations of treatments. Apart from talk therapy, there are medications for depression. And I think as soon as individuals is becoming having a very persistent low mood, not enjoying things, no longer going out, becoming isolated, not sleeping well. And I think these are the simple things that people should be able to ask people for. And say, look, I've not been observing you sleeping much as you used to sleep, or you've been sleeping more than you used to sleep. When you observe all these major changes, always let them talk, ask them questions, and then let them seek help. So your doctor may want you to seek some kind of talk first, and then if this one is not helping, then they can say, well, there are some antidepressants that they might prescribe for you. Also, with schizophrenia, that is a very long-standing, mental health difficulties where an individual is in touch with reality and all that. Some people might need admission, some people might just need some, antipsychotic medication. And I think in all, what is important in preventing suicide is managing suicide is preventing it, which is very, very, very cheap, at the individual level, at the family level, and also at the population level, which is the responsibility of the government to improve provision of Medicare, especially mental.
Thank you so much. Now, the final notes. We've talked about suicide today, and it sounds like something alien. Somebody just said, oh, I've never seen one. I've never heard one. This is a personal question I'm going to throw at you. Have you ever been involved in any case like this?
Well, of course, if you're a psychiatrist, this is what we deal with every day. But it's not that we see people committing suicide every day, because if we're doing that, that means we are failing, So, and the major complication of mental health is an individual taking their life because they haven't seen any, other solutions or other help. My practice, and I think more than 15 years now, I've directly been involved with two cases, tragically, but and I think all this is not something that's perfect, because sometimes you do things and things does happen. I think those two cases, and I think it does happen even within our society. But it's just that, like we said, people don't talk about it, and where data are not being collected, and people don't even do, don't want to know what kill people. The only ones that we know about are those that happen in the public. You had someone's died following brief illness. So just like I said from the beginning, quoting from the statistics, 80% of suicide globally does happen in low income and middle income countries. I think Nigeria is one of them. But people would say, well, I don't think I've ever heard of that. But it's just because they are not being reported. They do happen. And I think all these factors that we've talked about, is what people should look at.
Any experience with the patient?
Well, of course, personal experience, and I think twice. And so, of course, one of those in the high risk category, middle age people within their 40s and 50s, coming in an emergency, having severe depression, what we normally refer to as psychotic depression. Becoming really agitated, and I think it's a kind of a pain that they want to end as soon as possible. And so these are the categories of people that are of high risk, in fact.
Right.
So, yeah.
Thank you so much. So we're going to round up now. Thank you so much, Dr. Omokanye. It's been an enlightening period. So
Yeah.
we talked about suicide. We've talked about, we defined it. We talked about people who are prone to it. We talked about things that can make people actually wanting to do it. And then we talked about the signs, symptoms, things you can pick, and how you can protect your own mood. We've learned from Dr. Omokanye today. From his vast experience in psychiatry. And I hope that to the viewers that you have picked one thing or the other. I think one thing I've picked here today is the fact that do not underestimate that power in relationship with your friends, with your family, with people who you trust, people you love. Keep the relationship going. If you have not heard about somebody for some time, give them a call. If you have, for any reason, there's anything, just try and chat them up. We talked about social media, the impact of it, the negative, the positive, and we can tease all those out and, one way or the other, see which area affects us. We have not said don't relate with your social, with your religious lead. We're saying that your religious leads, there is that room for the impact, and then we also say that there's that impact for from the medical aspect of things. Thank you so much for being part of the program today, and we wish you the best of the weekend. And as we prepare for Christmas, please stay safe. Don't forget, Corona is also on the way again. The level is rising in our society. Don't let's ignore it, please. Use your face mask, social distancing, do all the necessary, and protect yourself, protect your family, and protect others. Thank you so much for joining us today. Until we see you again next week, have a wonderful week. Bye-bye.